Hi, my name is Dr. Jasmine Thum, and I'm a neurosurgeon here at the University of Alabama at Birmingham. In this video, I'm going to explain what a responsive nerve stimulator, or RNS, is, why we recommend it, what surgery involves, and what recovery and programming look like afterwards. A responsive neurostimulator is a small implanted device that monitors brain activity and delivers stimulation when it detects patterns that may lead to a seizure. Many patients think of it like a pacemaker for the brain. Instead of providing continuous stimulation, the device listens to your brain signals and responds in real time. This is a little bit different than another type of neuromodulation device you might have heard of, called a deep brain stimulator. We recommend RNS for patients with drug-resistant epilepsy, especially when seizures arise from one or two specific regions that cannot be safely removed. Long-term studies show about 60 to 70% of patients experience meaningful seizure reduction over time. The surgery is performed under general anesthesia, so you are fully asleep for the entire thing. Electrodes are placed on or within the areas of the brain where seizures begin or spread to, and are connected to a small neurostimulator or battery that sits within the skull. After surgery, you will stay overnight. We obtain imaging to confirm placement of the electrodes and ensure there's no bleeding. Most patients go home the next day once recovery is progressing well. We want to make sure that you are able to eat, walk around if you were able to do so before surgery, and that you don't have significant pain, although you might have about a 5 to 6 out of 10 headache for the first few days after surgery, and that is all very normal. All brain surgery carries risk, although serious complications are generally uncommon. Bleeding occurs in roughly 2 to 4%, and infection occurs in about 3 to 5% of cases. If bleeding does occur, it's usually very small and can be watched in the intensive care unit or ICU overnight. We will control your blood pressures to make sure that the bleeding does not worsen. If you have a larger bleed, the risks of this are usually very low, about 1 in 1,000. You may experience symptoms that are similar to a stroke, with difficulty moving part of your face, difficulties with speech, or difficulties with moving part of your body or sensing part of your body. As I mentioned, though, these types of complications are very rare and typically do not occur. If they do, typically additional surgery is not needed unless blood accumulates on the outside of the brain, usually underneath the battery itself, in which case we might need to go ahead and remove the battery, evacuate the blood, and put the battery back in. If an infection occurs, we usually try to first treat it with antibiotics, but if we are concerned that there is a significant infection that might spread to the brain, all or part of the device may need to be removed. At this time, you'll be treated with heavy-duty antibiotics, usually through an IV, for a period of a few months while we clear the infection. Once the infection is cleared, the device can be placed back again. The device is not fully activated immediately. About 2 to 4 weeks after surgery, your neurologist begins programming. The therapy learns your natural brain rhythms, so it may take several months before you notice any sort of benefit. In terms of your long-term expectations, the RNS system works continuously in the background, monitoring and responding to your brain signals. When the battery needs replacement, only part of one scalp incision, the area where the battery sits, needs to be reopened. The battery replacement itself takes about 40 minutes, although the overall procedure is longer because general anesthesia is required. You will also use a home monitor to upload device data, so your care team can review progress and adjust programming over time. It's very important that you download this data on a regular basis so that your providers can review this at your clinic appointments. You will also have device representatives who can help you every step of the way in understanding your device and how to best use it for your care. Responsive neurostimulation is an advanced, personalized therapy designed to reduce seizures while preserving important brain function. RNS is just one of the many tools that we have to treat epilepsy here at UAB. If you'd like to talk about other therapies, I'm always happy to do so in clinic. However, usually if you're being referred to this therapy, it's because we as a group, the neurologists, and the neurosurgeon, myself, have decided that this is a good therapeutic mechanism for you. I'm happy to discuss any questions that you might have when I see you in clinic. Thank you for considering UAB.